Say Startup Nation, like that's already been done. So I'm going to say good morning, awesome startup people all around the world who are looking to break through on this fine and beautiful and awesome Monday morning. As usual, you will be getting tips and secrets from a VC who has invested in hundreds of early stage companies. And as usual, I'm going to take everything that came from last week and I'm going to share it with you. I'm going to take like the 300 companies, everything that happened in the entire week, and how to try and get you the learnings, not the stuff that you're going to learn from, how we became rich or how we built a unicorn. No, not from like 5 years ago, from literally today moving backwards. And it only ever covers two topics. It's building through growth and through your customer, or stroke and what's happening in the investment space. So I want to start in the investment space and I want to work our way backwards. Beware of VCs. This is my big message for you this week. We had one of our companies this morning get retraded by a VC. What does retraded means? Retraded means that the company gets a term sheet. The term sheet is a very okay term sheet, reflects the market that we're in today. In this particular case, it was lots of millions of dollars. The VC will then create a no shop inside the term sheet. The no shop will say, you can't go anywhere else with this. And if you do, you will get into huge trouble. And then right towards the end, after the company hasn't looked for any investment elsewhere, has killed all other opportunities of investments, they retrade the deal. And retrading the deal means they come in at a lower valuation and they go for terms which are extremely unfavorable for everybody else. It happens. And it is happening now today more than it's ever happened before. And look, part of that is the VC's fault. Part of it is the market's fault. And part of it is the startup's fault, right? It's the VC's fault because you shouldn't do this stuff. I don't know. Like, I come from a place where your word is your bond. What is it? Am I like the only traditional is it even old fashioned to want people just to stick by their word? Anyway, that's how I am, and it's how I like the people around me to be, and it makes me sick when people change it. And everybody has a justification. Oh, the revenue moved slightly off the mark. Oh, the market isn't quite what it was. Oh, I didn't have any fruit in my breakfast this morning, but it doesn't matter. You retrade a deal, no bueno, okay? The market, why is it the market's fault? Because this market is a mess. Again, more things that are happening in the market that you can see right now is that I just saw, again, on term sheet this morning, they were speaking, I won't go into names, but they were speaking about one of the major billion-dollar VCs who are firing everybody left, right, and center. Why are they firing everybody left, right, and center? Because they have been keeping their self-abuse a close family secret for a long time, like most other VCs do. And because funds are not publicly accessible by anyone, VCs can keep bad performances an extremely closely guarded and well-kept secret for a long time. In their minds, many of the VCs thought to themselves, wow, 2021, hard. 2022 will be better. Nobody will notice. I'll keep raising. I'll tell people outside that it's okay, even though it's not. 2022, no good. 2023 will be better, and 2024 exactly the same. And neither 22, 23, 24 has been any better. Actually, it's got worse. The market we're in right now, after 3 years of 5% plus interest rates, what I would describe as a recession, even though technically the world doesn't want to acknowledge it as such, and the fact that there haven't been any exits of note in the entire startup space for the last, 2-3 years, has all contributed to the fact that this is an extremely difficult market. And there are a lot of VCs who are genuinely afraid. Maybe they wouldn't have retraded in good times, but they're retrading now in bad times, and they're holding off on deals they would have done in 5 seconds before. Final piece is the entrepreneurs themselves. For years and years and years, in the good times, entrepreneurs were looking for investments on terms which were so ridiculous. Like how a company can be worth $50 million when it was started like 5 minutes ago is like beyond my comprehension. But that happened for a long time. And so now the pendulum has swung and the unfairness is swinging the other way. All of this points to just one thing. It points to the fact that if you are focused on growth, if you are focused on your customer, you will not lose. That's what this points to. This market is a market for the brave. It's a market for customers. It's a market for growth. If you do that, then you don't become needy. And you don't need me to tell you this. It doesn't matter what the relationship is, romantic, VC, job related. The moment that you are needy, the moment that you absolutely have no other choice but to go in this direction, you are dead in that relationship. So I am appealing to all entrepreneurs. If you started this week thinking to yourself, I need to go and look for investment, I need to speak to investors, I need to put the majority of my time on investments, then I want you to change your mind and go in a different direction. The second thing I just want to go into here is on the way where the investors are happening, is just to keep an eye on what's happening within the market. You'll have heard me speaking a lot about crypto, a lot about blockchain, a lot about Web3. Some of that, excuse me, some of that is because there's really good opportunities in those spaces. But some of it, and also the world is changing, AI and blockchain, and being able to fractionalize and tokenize, as well as being able to add efficiencies and automation into technology, for me is highly interesting. But another part of it is because I'm watching a migration of VCs, who are those same VCs that I spoke with, who are actually realizing they can get better and quicker returns from Web3, at least perceptually, right? And that's a big friggin' deal. And so I want you just to watch it. You don't have to change anything. You don't have to like start tokenizing or creating a token or do any of those types of things. I just want you to be aware of what's happening in the blockchain space. And I want you to keep an eye out to see if any of that can be relevant for you. Okay, so here's what we're going to do right now. We are going to go to the most important part of this live stream, and that is that we're going to bring in a founder who's doing amazing work, and that founder is going to show you what she has created herself. Okay? Okay. Leah, welcome to the show. How
Hey,
are
Brian.
you?
Good.
How are you?
It's been a while, but doing well.
Yes. Tell me all about you. Tell me everything that's happening with you.
Oh my gosh, where to begin? I'm so excited that we're doing this because I feel like we need to kind of co-opt this session for all of the amazing feedback and advice that you have given me over the last couple of years in my entrepreneurial journey. We have so many different things going on, from amazing advancements in our product to expansion of our customers to expansion of our team and now to everything you just
Because
said
you're
about.
winning, because you're winning on growth. But actually, let's start in a slightly different place. Can you give everybody, I am giving the overview of, you are one of the fastest growing companies in the Expert DOJO portfolio. You are on fire. If you're an investor listening to this call, you should be watching very, very, very carefully, because we are only showcasing the ones who are lighting up the world. And then if you're a founder on this call, you are going to learn about how to build growth. If at the beginning of the call I spoke about the challenges within venture, how confused everybody is, how hard a market this is, at this stage of the call I want to talk about like how you build it on your own. But Leah, would you talk a little bit about the company, talk a little bit about what you've built, maybe the genesis of where it came from, and then we're going to dig into like how you've got yourself into such a great position now.
Yeah. Well, fundamentally, we are using real world patient feedback to completely revolutionize the space of cash pay regenerative medicine. And it's one of those Wild West markets, which I think offers both opportunity but also challenge. And in cash pay regenerative medicine, these are treatments like platelet rich plasma, stem cells derived from your bone marrow, derived from your fat. And a lot of doctors are now seeking alternatives as in response to what patients are looking for. So these treatments are being used to treat things like osteoarthritis, joint pain, joint dysfunction. They're even using it for hair restoration, erectile dysfunction, other emerging options, especially in age-related conditions. This idea of longevity and health span being more should be more prioritized than just lifespan, which is kind of what traditional pharma is really looking at, or traditional solutions are looking at. So in this space, though, because there isn't the traditional big players like pharma and med device and health systems, this is really a grassroots, community driven approach to advancing medicine. And so in this market, doctors are being introduced to new treatments and new products almost every day, but most of these products don't have the traditional, FDA approvals and clearances that come with reimbursement. So they're adopting these treatments into private practice, and it's really hard to do research in private practice. And so our company was founded by physicians who were absolute pioneers in the space, and they developed a platform that can easily track and expand to all of these new treatment areas. So it started in biologics, which is or these treatments that source biologics from cells from your own body. But we also track things now in this other emerging field I call energy devices, like laser therapies, shockwave therapies, electromagnetics. A lot of them are starting to put this in combination with the biologics. But the problem is there's such sparse literature and no standardization to how this is being approached. And so the treatments that are actually working well for patients, nobody knows. And nobody knows who's going to benefit the most and really what's the right price point for any of these treatments. People are traveling all over the world, out of the country for trying these experimental options, which generally are relatively safe. It's just the question of, are they effective? And that's really what our solution is getting at. We've created a very simple platform that allows doctors to enroll patients, and our system automates that outreach to the patients over time after they've had these treatments. So we're collecting really nuanced information, clinically validated surveys related to function, pain, mental health, satisfaction, adverse events, as well as all of the information about how the treatments were delivered. And because of that, we now have one of the largest standardized registries in the entire field that spans almost 30 treatments today, over 100 products that we're tracking data on. And ultimately, what we're trying to produce is something like consumer reports for cash pay medicine, where there today is a total black box. How can we
I
bring
love
that
it.
information to light?
And that's the problem that's being solved, because there is total darkness when trying to
Right.
understand the data of individuals, and you are bringing light where that darkness is. And like, this is normally the type of thing that you would be talking about a large organization putting together, but you built this up on your own. So can you talk a little bit about how you did that, how you managed, because it's also not like a cheap thing to build. It's not easy to do,
No,
like having to
no.
build up a team to be able to create it. You also, it's in healthcare, which is a bigger problem, because the actual level, the bar of the information that you have to provide is so high. People need to trust you, and if they don't, you're doomed. So talk to us about, I want to go into like the early days of growth, when you had the genesis of the idea, you knew you needed to build it, you knew you needed a certain amount of money to get started. Can you talk us through this journey and how you got that first level of trust from your consumers?
Well, I think what people don't generally understand about the field of medicine, tech industry in general looks at medicine like, why the heck are they so slow to adopt anything that's obviously a great solution? And the reality is, everything in medicine adopts from clinicians to clinicians selling each other on new ideas. And they do that through a foundation of evidence, and it has to come from their own personal experience. So, medicine is a really kind of tribal, faction led culture, and if you don't have those pairs and those stories that resonate with the right, siloed groups, nothing progresses. So really, it was me coming together with the original founders of Data Biologics, who were focused on the evidence. And what's been a really great benefit to us in the last couple of years, especially with all the things you mentioned around funding, is we've really grown our not just our revenue, but our registry and our user base through word of mouth, through physicians telling each other, you got to contribute, got to get part of this. This is how we're going to make this field, valid and expand it. Just in the last 4 years, all the big academic institutions that you might know of, Mayo, Stanford, Cleveland Clinic, they've all adopted regenerative medicine as a field of rank. But that's the last 4 years. So what we're talking about here is a fast moving, evolving space in medicine that is kind of addressing a gap, right? Today, people are left with drugs, steroid injections or surgery. And most consumers now on the patient side, they're looking for these natural alternatives for things that make sense to them and that aren't going to necessarily take them down as ever spiraling, deterioration as they're going through their treatment
But
process.
talk to me
So
how
we've
you
really,
do that, because you have to do two things at the same time. You have to, on one side of it, you have to be able to give information to folks that don't even know a lot of this is going
yeah.
on. Like it's super nascent that it's starting. And the second half, you have to build trust. So let's start. We're going to work our way backwards. How much revenue so far this year, or how much revenue expected to the end of this year?
So we're on track to do about 750,000 in ARR at the end of this year.
Sweet. And that compares to last year?
We finished last year at about under 100,000. So we are growing at
So you're coming up
really
like a
fast clip
spaceship.
on this. Yes.
And then so for and next year, let's do next year first.
Well, next year I'm going after 2 million
Yeah, so we're going straight up
here.
again. So again,
Straight
that's
up
another
again.
200% growth, just around 200% growth. So we're looking at like from last year to this year, 500 or 600% growth. From this year to next year, just around 200% growth. And then once the company's sitting at like $2.5 million, then the jump to like 7.5, $10 million
Exactly.
is much easier because now they have a big team and everything in place. So I
Exactly.
want to like speak about at the beginning when you knew it's so hard because you have to educate with that information, and you have to build trust at the same time, and you're working on referrals from doctors, physicians, people like in
Yep.
surgeries, who are the hardest people to get referrals from because
Yes.
they're afraid of everything in case they get into
Yes.
trouble. So what did you do? Did you cold call them? Did you drop in on them? Did
No,
you
so
WhatsApp
this is
them?
where my very, very unique experience in the industry comes in. So I spent, I did my training as a biomedical engineer. So I have a very deep technical foundation, but I jumped into sales and marketing of disruptive medical devices for most of my career. And all of that was, like you said, they don't want to change, but it's building trust and a rapport with physicians. And you do that through getting endorsements of other physicians. You say you should work with them. You should work with me. That I can support them in this kind of transition. And so the other thing that we have going for us that's so different from any other kind of registry in the space is we weren't pushed forward by the industry. We were pushed forward by physicians. So my community of physicians views us as the physicians registry, which means the data that they put in and the friends and the network that we're fostering right now, they're all looking at it in the same way and they're all following the same process. This isn't like one company has come along and done a study and they've framed it in a certain way, or one academic institution that's sort of hoarding the power of the space is owning what information gets distributed out to the community. This is in real time. Our customers today, they can go and explore all the 20,000 cases that we've got that are maturing in this database on all of these different treatments, unrestricted. This is the physician's registry. They have the ability to explore this data. But to really bring everything full circle, it's not just about physicians; it's the whole ecosystem. So the medical device players, the biotech companies, they all have a part to play in this as well. And a lot of them, especially at the stage that we're working with, they don't have big budgets for research either. So they're looking for a turnkey solution and they're looking for something that can help them, especially where most of the adoption takes place, which is in private practice. They don't have infrastructure for research. So we're
Yeah.
starting to partner with medical device companies, especially ones where we've already been collecting data on their products, something that is very hard to do in the real world. But because our physicians are really the ones driving the direction of the platform, it's been very easy to bring medical device companies into the conversation who can not just access the data through our subscriptions just generally to see what's in our what we have, but we can also provide a higher level of service to those med device companies in structuring studies that can support maybe a regulatory pathway or marketing and sales engagement. But for me, it's been not so much cold calling and outreach. That's really where we're headed next, is this kind of mass outbound marketing approach. But for the last couple of years, this has been physicians empowering our key opinion leaders who have put a lot of evidence into the registry. They're getting up on stage at medical conferences, sharing the insights. I'm getting up and sharing the insights. And because we don't have any ownership by device or by academia, we're really viewed as that neutral, like I said, consumer reports approach to a field that otherwise is just complete, wild west. And in general, medicine is that way. Also, there's not a lot
Yeah.
of transparency into what
And
works and what doesn't.
And so, what's really interesting here is that you realized that this is a burgeoning space. You realize that there's aligned interest or aligned greed, as I would say it in my space, in a
Yeah.
really good way, because you have the
Hmm.
medical device companies that need to know about this stuff because for them, it makes them and what they're looking to do go faster as well. You have the physicians that need to know about this stuff and they're looking for key opinion leaders in the space. And then you have the key opinion leaders themselves. And I refer to this about going from domain awareness to domain expertise to domain dominance. And that domain dominance can only be built really by building your own fame. And a lot of that time, that fame is built through really strong partnerships, really strong media, or strong epic productions that you're building. And in Leah's case, for Data Biologics, everything is about building those partnerships and empowering the partners so that she can then sit on the back of those. So when they start referencing important information within the industry, they actually start referencing Data Biologics as the reference point for that information subliminally over time. You know what it's a little bit like? There was a thing, I always remember watching this with Tony Robbins, where he would start, and it's where they mirror what a person is doing. So he would sit in front of someone and that person might be just rubbing their hand like this. And so he would just not quite exactly the same, but they would like quietly just rub their chin like this. And then maybe the person would cross their legs. And then just a couple of seconds later, then he would cross his legs. And maybe the person had folded arms and maybe he would then come in and fold his arms. But a moment comes where the control reverses, because what's happening is you're intentionally mirroring the person to the extent that the person feels very comfortable with your physiology. And so comfortable with your physiology that when you uncross your arms, the other person uncrosses their arms as well, because you've now taken control. And so what I really like about creating this environment where you're empowering all of these people to get information which makes them look and feel better is that after a while, they start crediting all this information to you. And this inherent trust is built from the outside. And I can't look, the numbers speak for themselves, right? The company has grown from under $100,000 in revenue to $750,000 in revenue in 1 year. How much money have you raised, Leah?
So we've raised just under 700,000 in our pre-seed.
Nothing. Nada. Nada.
Yep.
Nothing. And that's what's so beautiful about this is that when you build like this, when you build with the direct objective of becoming a key opinion leader and building up your domain dominance through epic production after epic production after epic production, then what happens is you don't need a ton of money to do it. Now, here, that's the upside. The downside
Yep.
is it's a little bit tiring, right? Because
It is.
you are brutally working
Yes.
like 17
Yeah.
hours a day.
Yep.
And I can't do anything to make that sound nice. But
No.
it is very rewarding when you come out the other side, right? And you look back and you just think, wow, we just grew our revenue by 550, 600% in 1 year because the tactics that we had, which were tried and tested and true and helpful and supportive of our industry, like those tactics work so incredibly well.
Yep. Yep. In fact, I've completely changed even our target for raising right now. So and the way we're raising because of this kind of realization that the customers, being our doctors primarily, and the patients of the field, are hungry for the information, but they are also left out of these other big pictures, right? The trials and the academia. So the way that we're approaching the next round of raising is really as a hybrid with a crowd. So we've set up a regulation crowd fund on WeFunder.
Ooh.
And we think that's just and lessons learned and trying to raise capital and deal with the rodeo of venture capital. We still have a
Yeah,
path for that, and we
VC.
definitely still want to have those types of people involved. But at this stage, we're on track to be profitable in the beginning of next year. Where I don't necessarily have to raise massive amounts of money. We've got a really great lean team, and we're
Well, hang on,
leveraging
Leah.
AI in every way we can.
Leah, just hang on one second, because we're going to have to, sometimes we have jargon on this live stream that people
Mm,
don't understand. Profitability is when you make more money than you lose. It's a really
yeah.
interesting concept in venture capital. Nobody's ever heard of it before. But
Right.
trust me, like when a company does it, it's really, really, really good. Okay. And investors, you should really like this as well. So yeah, no, and look, you're saying all of them, like, and you're saying it's almost like you're painting a storybook of how to build a unicorn. It's find your customer, make sure your customer loves you, make sure that what you have is really needed by a customer. That PMF, that product market fit, is like everything at the start. Then focus everything around in your space, making sure that you can create that domain domination through those epic productions and becoming key opinion leaders all
Yep.
the way through. Then you focus everything on making sure that you're building yourself into a place where you don't need investors. If investment comes in, it gives you a little turbo boost. If it doesn't come in a huge way, you got profitability. It might take you a year or 2 years to get longer to get there, but that's okay. That's a year, 2 years of more love. And what I love about what you're saying is you're layering on different outbound strategies based on the time period that you're in. So at the beginning, it was
Yes.
about, without trust, we're dead. We're
Yeah.
dead. We could cold call all day long, but we're wasting our time. So we're dead. So we're going to build a key opinion leader. But now that we have that, the way to get from 750 a year, or from 750 plus a year to 2 million plus a year, that is by absolute aggressive market capture. So I love that you're combining all of this next year. And by the way, I'll mention one other point, and then I want Leah to talk about this a little bit, because I'm so proud. Like, it's so amazing what she's doing. This is the stuff. This is what, honestly, this is kind of why I came to America. This was the type of entrepreneurship that I had heard about when I was back home in Ireland. And I was like, these people are the center of entrepreneurship in the world. This is how it should be done. And then I have just been constantly disappointed year after year since I've been here, watching money take over entrepreneurship. So when I hear Leah speaking like this, when I know that we've invested in her and her team, when I know that we're going to keep on investing and that other investors are going to come in, it kind of just makes me really happy, because I see what an amazing job you're doing. So is that the plan, Leah? Like, you take it next year, you
100%.
go hardcore
Yep.
on outbound. Talk to us a little
Yeah.
bit about what that would look like.
Yeah. So what we've really done over the last really 12 months is, develop a reproducible business model, some differentiated offerings, understanding the variety of interests that our customer base has. Everything from I just want to know my evidence and track my individual patients, to I want to publish papers and speak nationally and globally about these treatments. So we've had to kind of really hone in on how do I best empower our key opinion leaders, which are really just everyday contributors who are passionate about the field. But now what we have is not just a database, but a database that is primed for production of content that powers up all of these different lanes. But for, like you said, for really getting that market presence out there and going big with marketing growth, you have to have content, you have to have an engine, and a workflow set up. So we've made investments into our CRM and into some expertise that has come in to help us really get our outbound scalable. So everything from acquiring, multiple domains. I mean, we're really setting up like for that future, that consumer reports future with, domains like doesprpwork.com. That was one of the fastest trending search terms in Google over the last 5 years related to the space. So I just started to, acquire things that I know are going to be important for a big marketing push, but also starting to analyze the market. And that is my specialty. That's what I did for years in industry, was really leveraging information coming out of medical claims and also out of Medicare. So we've actually created a targeted profile for the types of practices that are going to benefit the most from our solution. We've quantified that. We know exactly who they are, where they are in the US. We've brought in massive lists that allow us to segment and produce our solutions. So some practices, they might only be doing PRP injections for knees. Others might be doing very complex spinal conditions. And so it's really, how do we now segment the information, the insights that we have off of our registry to these types of physicians that, having tested over the last year with our current customers, we know is of interest. And to your point, to get started in this, it was really about attending the medical conferences, listening to the dialogue that these customers that are now customers have with each other and what they were presenting on stage. And then us really going back and saying, well, can we answer this in a better way, in a bigger way? And can we do it fast? And that's what we started to do. And our these speakers not only are referencing, papers that take years to get out onto the market, but they're saying, and Data Biologics has 10 times the data on this same topic. And it also says this. So we're validating what real world data really could be and the role that it can play. We're not saying it replaces structured, controlled, high level evidence. No way that that's going to go away. But this can really make things so much faster and more transparent to get to that end goal of what things are. So we're setting up our operations for that outbound, higher level outreach, knowing, you have to start first by really understanding the market very deeply. And then separately, working with device companies and research institutions, those require some higher level touch, some more services. So that's where we're going to apply more of a direct sales approach, which is a lot of what my primary experience in sales has been. So I'm working on how we're going to really apply direct sales there, but outbound marketing at scale to reach the masses of physicians who might either be already adopting these treatments or considering adopting these treatments. And we can really inform what's the right approach, who's the right patient, which products are actually delivering on what they say. So you can just efficiently bring that into practice instead of the slow trickle of information that is the standard today.
Amazing. So you're ticking the three boxes. One, doubling down on outbound so you can find more and more customers, continually revising it to the best possible channel to get your customers. Please, startups, listen. This is a masterclass on how you build a company that gets to $10 million a year in revenue. Would anybody bet against Leah hitting that right now? Number two, you're continually improving the product and working on the product. You're not just happy with building up the domain expertise by building up the key opinion leaders and then making your company be seen as the platform that provides that trusted information, but you want to keep on building that up further and further and further with no stop to it. And then the final point, which I don't want to go unmissed, is like how you're raising money. You're going to your audience to raise money as opposed to going to a disparate group of people who have misaligned interest with you. And I'm not saying that VCs are bad. We're a VC. Can't say that. No matter what I think, I can't say it because it would be bad. But I can tell you that we have nothing to do with like the journey that she is on. Like, her journey is a journey of people who are ridiculously focused on one thing and one thing only, and that is health. It is health consciousness, nothing else. And so VCs are focused on an entirely different thing, which is making money, right? And that means that there are times when you go on this journey together, especially if you start too early and the toxic relationship begins with too much power with the VC, then what happens is you get pulled off in a direction that you don't want to go to. So this obsessive focus on the customer is even extending for Leah and her team to the actual way that she's raising money. And by doing a Reg CF, which is a regulation crowdfunding, which means non-accredited investors get to take part in the business, it means that she can build out the investors whilst building out the customers at exactly the same time. It's also, I think, a really beautiful thing to do because it's a company that normal consumers can understand. They can see the growth. They can understand how it's being built. You don't need to be a VC to see that this company is going to continue on scaling and it's going to get sold in the future. And so it's a really beautiful way of doing it. Look, I'm a huge believer in Regulation CF. We did a campaign ourselves a few years back on WeFunder, and I can tell you it was one of the most impactful things I've ever done. Even almost, I would almost say it was number 2 after the TEDx talk. Like, it was that big a campaign.
Nice.
It was also brutal and hard and
Well,
like
yeah,
unforgiving.
that's the part that that's really where we're just well, getting it set up is sort of brutal, and what I found was, you know, the process of trying to raise from traditional investors, whether they're angels or VCs, there's a lot of excitement, but every one of them has a different path for diligence and wants to answer questions and all these things. And I'm just like, wow, I just need to be focused on this business. And I want to be able to support that. We need a more efficient way. And I wasn't actually thinking about it until my customers came to me and said, have you thought about a crowd fund? Because we would all want to be part of this in a significant way. And I'm like, well, that's okay. That sounds actually great. Seems very efficient to do that. And I have a really big network, not just of potential patients who might want to benefit from this. We get patients that write our info email all the time, like, I'm considering this treatment, who's got really great outcomes, or here's the doctor I'm talking to, he says he puts cases into your registry, can you tell me anything about his outcomes? I mean, the consumers, especially for these are thousands of dollars for these treatments, they want to know what they're getting. So for me, it was much more about, this could be an efficient way to have our story consolidated and expand the potential for bringing in investors to really benefit on this journey with us, who don't have to be $100,000 or $1 million investors in order to come to the table, and then really just set us up to get us to that next stage, which we want to continue making big investments into the company. But for me, it's really about being thoughtful about how we can, now that we have this database, and you were talking about the blockchain space and how that is evolving. We definitely have a strategy around that, but also AI. Everything to do with AI is moving so fast, and data is gold in the space of AI solutions. And we have a highly structured, clean database that doesn't exist anywhere else. And our customers are going to benefit, and our investors are going to benefit from our ability to add the context that also is so important. So my entire team is what I call humans in the loop. Every single thing is about adding the context and the expertise to clean the data so that our AI solutions can be as accurate and scalable as possible, and really bring both sides of the equation, which is how we put some reins on AI going forward into the future.
And I want to, just before I give you the chance to close us out with speaking to your vision of kind of where you're going to take Data Biologics in the future, I want to, again, there's so many points that you're covering here. I just don't want to miss any of them. The crowdfunding piece is a huge piece, which you're talking about. And you're evolving on what I mentioned about the values of crowdfunding, in that, number one, you get to really share your vision. You get to really work on your vision. Like, crowdfunding forces you to
Yes.
speak to where your purpose tethers with your vision. Like, it's a really beautiful thing, because most of the time we don't have time for that. The other thing it does is it forces you to speak to lots of people you haven't spoken to in ages,
Yes.
especially in startup, because it's such a beautiful, brutal journey. But we get so siloed down one way that we don't get to speak to like all these people who can be incredibly helpful to us as we're going through the journey. And you now get the ability to do that by creating a highly systemized plan that will allow you to do it. But now you've tethered on top of the domain dominance. You've tethered on top of the, don't be reliant on investment, do it on your terms. You've tethered on top of, build your outbound strategies in stages so that you don't confuse yourself and drive yourself crazy. You've tethered on top of, raise from the crowd. You've tethered on top of, getting 600% growth and then planning for 200% plus growth next year. But now you've taken us to a whole different place, which is super interesting, which is the Horizon 3. And the Horizon 3, remember everybody, you don't need to build out the greatest product in the world at the beginning. Uber started out being an incredible product and then developed into Uber Eats, developed into 100 other things. Amazon started out with the most incredible product in the world and turned into a logistics company in its Horizon 3. It's almost impossible to work out your Horizon 3 while you're still in Horizon 1. But I love that what you're talking about is that you are, although not spending all of your time focusing on it because you're spending your time focusing on growth, you are so aware of the fact that your Horizon 3 is going to include blockchain, it's going to include more artificial intelligence being built on top, it's going to include richer data that you're going to bring through, and it's going to include new distribution methods to get there. Can you just, in these last few minutes, up to this entire time, you've been speaking to really startups about the lessons that they should take into account when building a great company. And I promise you, startups, you won't get any better than this. This is laser focus on one thing, and that is making sure that the customer gets the most incredible product ever, and it's delivered to them all of the time. So even if you re-listen to it, take the gems out and apply it to your companies for yourselves. But Leah, if you're speaking to investors on the end, at the end of the stream now, talk to them about what you see the company turning into in the future, and like maybe going a little beyond 2024, where we know you're going to hit 750, 2025, where we know you're going to hit $2 million. Talk to us about where the company goes from there so they can feel what their exit would look like.
Yeah, absolutely. So there's an evolution. So we have a roadmap that is, servicing today. What is our product today? How do our customers access that? But fundamentally, what is the most valuable thing that we have is a highly structured database and a large network of physicians who are unaffiliated with each other. And because we can quantify of tons of different variables, one of the gaps in medicine is the speed at which research can come out, and especially research out of academia. So the first kind of step in our solution iteration will be automation of clinical abstracts, clinical publications. So we can already do that in our we're parallel paths here. We're developing that right now, and we're developing solutions that help bring data in, clean data, and have it come in from multiple different sources. And so we're testing those with our closest customers, our advisory board. We have a lot of different people, different hands in the pool for that. But from there, it evolves into things like continuing medical education, webinar content, things that physicians are constantly in need of. It's a $50 billion industry by itself. Every weekend there is a course going on, and to maintain your license, you have to attend these kinds of courses. So there's always going to be a never-ending need for content. But for physicians, if you've ever been to a doctor con, that's what I call these conferences. They're terrible presentations. So we want to make that really easy and get more voices on the stage, so it's not just the same thought leaders over and over and over again, but really representing the much bigger field that exists. So we can automate that kind of content generation. But then from there, we're really going to turn and go towards the consumer and creating a front door to the field, which goes back to your point on trust. Becoming the most trusted brand in the space for validating outcomes, validating practices, identifying, ranking, and rating products on the market. We can make a really efficient place, an essential source of information for patients to come in, find a doctor that is best matched to their needs. And again, patients travel for these treatments. These are, they're traveling all over the world. So the market that we're really focused on in the consumer space is already primed for this kind of investigation and then matching with physicians. But then the biggest, the big picture is really powering the entire ecosystem. How do we make it extremely efficient for doctors to select and acquire the right product and the right training in their practice, and for patients to select the right physician and treatment based on what we know about them. And some of that is based on how they respond to the surveys. Some is based on their biology. Some is based on their history. So we can really leverage, the power of AI to do big calculations to make it very simple. And then of course the large language models being able to translate that into ways that the average person can understand. But at the end of the day, I don't think anybody trusts AI today if you were to ask it a question. So we are training our AI to be completely focused and aligned on the data that our expert humans in the loop are curating and cleaning, so that that level of trust can be maintained as we further advance our AI
I love it.
solutions.
I love it. So using very deep technology and data to be able to advance the physician's ability to be able to help patients live healthier and happier lives. I don't know. Is there anything more important? I don't think so. I don't think so. Like, no, there's nothing more important. So look, Leah, thank you so much. It's been amazing being with you on the journey. I'm looking forward to the next part of it. Entrepreneurs out there, learn from this. This is how you build a great company in these times. For people like Leah and her entire team, it is incredible that it's a horrible fundraising time. They want to build something amazing on an even playing field. That's where they dominate. So Leah, let's finish off with your email and your details, get it out to folks so they can contact you directly, and then that'll be a wrap.
Yep. So my email is leah@databiologics.com, and you can find information on our crowdfund at wefunder.com/databiologics.
I love it. And that's a wrap. Thanks, Leah. Thanks, everybody.
Thanks.